Hello, I'd like to welcome everyone to tonight's webinar, Scholarships for Aspiring Dental Students, presented by the American Student Dental Association. We'd like to thank our generous sponsor, the American Dental Association. In addition to several other ASDA events, the ADA has sponsored Pre-Dental Month for 4 straight years. The ADA is committed to its members and to the improvement of oral health for the public. Please be sure to visit ada.org for more information. Before we get started, a few housekeeping items. All attendees are muted so that we won't pick up any background noise during the program. The webinar will be recorded and posted on ASDA's website, and a link will be emailed to all that have registered for the webinar next week. You'll notice a control panel on the right side of your screen. You can type your question into the screen, and it will be added to a queue. The Q&A portion of the webinar will take place at the very end. My name is Brian Jones. I'm ASDA's Membership Development Manager, and I'll be serving as the facilitator for tonight's program. ASDA has a staff of 14 association professionals and our central office located in Chicago. I've worked for ASDA for 2 years, and my main responsibility is creating and managing initiatives to increase pre-dental membership and engagement in ASDA. I'd now like to introduce our presenters. David Dinesh is a second-year DMD student at the Harvard School of Dental Medicine. He's born and raised a proud Ohioan and graduated from The Ohio State University in 2016 with a degree in microbiology with a minor in global public health. He received a 4-year National Health Service Corps scholarship for dental school training. He serves as a national ASDA leader, as a national contributing editor on the editorial board. As a contributing editor, he works with editors from other schools publishing Contour. He serves as his chapter's legislative liaison, coordinating advocacy issues in Boston and Massachusetts. And is passionate about public health policy, communication, and writing. Dr. Carl Larson is a recent graduate from the University of Colorado School of Dental Medicine. While in dental school, he held various positions with ASDA, including the president of Colorado ASDA and the District 9 trustee for the 2015-16 school year. He's a National Health Service Corps scholar and currently works for a community health clinic in rural Colorado. He's the current president of the Southeastern Colorado Dental Society. Andrew Horbley is a first-year student at Virginia Commonwealth University's School of Dentistry. He received the Navy HPSP scholarship and commissioned as a Navy officer this past August. Andrew is a resident of Virginia but graduated from The Ohio State University. He's currently involved in the pre-dental mentoring at local, district, and national levels of ASDA. Now I'm going to turn it over to our first presenter of the night, David Dinesh.
Hi there, sorry, my internet had some problems. All right, so we'll get started with an overview of the National Health Service Corps Scholarship Program. So this is a federal program with options for a 4-year, 3-year, 2-year, or 1-year scholarship. The scholarship includes tuition, any fees that are required for your school, as well as a living stipend that you can use for rent, cost of living, and also a sort of added benefit is the job security that you have after graduation. And how the program works is that it is a year-for-year service repayment for the scholarship, where for each year that you receive scholarship support, you serve at a federally qualified health center in an underserved or rural community. And one consideration is that regardless of how many years your scholarship is, there is a 2-year minimum service requirement. So that means if you apply for and receive a 1-year NHSC scholarship, you are still responsible for a 2-year service commitment in an underserved area, even though you only have 1 year of funding. And one other aspect of the program is that there are limited specialty and graduate possibilities after you graduate. because this is a public health program targeted to getting dentists to these underserved and rural communities that need dental care, there are deferments in this service after you graduate from dental school available if you'd like to pursue a specialty program or a graduate training program in a GPR, general practice residency, or AEGD, advanced education in general dentistry, or in pediatric, or pursuing pediatric residency, or pursuing a residency in dental public health. And however, for the other specialties, such as endodontics, etc., you cannot get a deferment for your service. This means that regardless if you got a 4, 3, 2, or 1-year scholarship, after you graduate, unless you are doing one of these approved residency training programs, such as the GPR, AGD, pediatrics, or public health, you must be practicing general dentistry. And one other aspect of this program is that there is the National Health Service Corps scholarship program, and there are also loan repayment options available after you graduate. If you, for example, you apply for the scholarship and you don't receive it, this is a separate program in which, after you're working in a federal qualified health center or a dental practice that qualifies to be a site in the National Health Service Corps, in addition to the salary and benefits that you get as part of working there, you get a lump sum loan forgiveness payment. You get a lump sum payment towards your loans. And in general, with this program, to apply, the application typically opens in March and closes in May, and then the scholarships are awarded in October. And this is after every dental school starts. However, for example, at my dental school, if you take out the loans for your first year, and then you find out you get this scholarship in October, which is exactly what I did, the loans can be refunded that you take out because it's within a certain time frame that you take out the loans. So don't worry about taking out loans for dental school and then seeing if you're going to get the scholarship or not. If you get the scholarship, your loans that you take out for that first year will be refunded if you get a 4-year scholarship. And some application tips is that you should start now. Start thinking about the application, start thinking about the program. Do you want to do this? Is this a good fit for you? Take a look at the requirements and components of the application, which I'll discuss in the next slide. The earlier you start, the better and hopefully most successful outcome that you will have. Sort of having a connection and experience with working with rural populations, underserved populations are extremely beneficial, both for applying for this program and for your own personal growth. You'll, by experiencing working with these populations and in these areas, you're going to see if this program is a good fit for you. And also, it will make you a more competitive applicant for the program. Furthermore, the program has specific priorities and preferences to applicants and gives preference to applicants that come from disadvantaged backgrounds, because these applicants are more likely to go to these rural underserved areas to practice there, not only for their service commitment, but beyond the service commitment. And that's sort of in general what they're looking for this program. They're not looking for people that just want to go in for 4 years, do their service, and just move out. They want people that are committed to making a difference in public health for these rural and underserved areas. Another factor is that you cannot apply to this program until you're accepted to dental school. So you need to have an acceptance in hand and submit that and verify that you're accepted to a dental school to apply for this scholarship. And furthermore, you should, as I mentioned earlier, you should make sure that public health and rural life is the right choice for you as a career. And I can't emphasize enough, but to review the application and program guidance document on the National Health Service Corps website multiple times. This is a very dense and long document, but it has 100% of the information that you need to apply and be successful in applying to the National Health Service Corps Scholarship Program. Definitely download this document, skim through it once, put it away, put it aside for a few days, come back to it again, read it again. It's very dense, but the more times you read it, the more familiar you'll be with the program. And with the requirements of the scholarship application, you need to show proof of citizenship. You need to submit a short authorization to release information. You need to show that you have an acceptance from a dental school to apply. You also must submit a CV and resume. There are also 3 essays required for the scholarship application, and you must submit transcripts from all of your college, post-secondary institutions. And you need to also share information about the current tuitions and fees of the dental program at which you're currently accepted to. And finally, the 3 essay questions as part of the application are as follows. First is, how will you contribute to the mission of the National Health Service Corps in providing care to underserved communities? And this is getting at to what I mentioned earlier, in that the National Health Service Corps is looking for committed public health dentists. And they're looking for people that will serve in these areas well for these 4 years of the service commitment, and also that will stay beyond the 4 years and making an impact in these communities. And the second question is, what experiences have you had or activities have you participated in that have prepared you to work with underserved populations? And this is trying to get at what you know about underserved populations, whether you are from a background of disadvantage or from an underserved population yourself, or what sort of experience have you had. And finally, the final question is discussing your commitment to pursuing a career in primary care. And this is getting at public health dentistry, primary care being preventing disease, and really making a difference in communities. And this is getting at what sort of your outlook is on primary care and primary care dentistry. And now I'm going to switch the slides over to Kyle. Let's see. All right, Kyle.
Okay. Are you able to see my screen?
Yes.
Okay. All right, so for my part, I'm going to be talking about, here, let me turn my webcam on. I'm going to be talking about the common misconceptions when it comes to this scholarship, because I get a lot of questions about certain things. And so the first one is that you will be working for the government, and whether you see that as a positive or a negative, it's not necessarily true. So jobs are independent sites. They can be clinics, federally qualified health clinics, community health centers, or they can be a government facility, such as a prison or whatnot. They're almost always government funded, though, so that has some good benefits to it as well. And like I said, they're practices or clinics, so they're independent from the government, but they are usually government funded. So just to clear that up. Another one that a lot of people always are afraid of when I'm talking to them about this is that you'll possibly get stuck working in a prison, and that's not the case at all. In fact, I haven't met anybody who has gotten stuck working anywhere, and the one person I know that is working at a prison type facility chose to be there. So that's good news. You get to stay, or you get a say in your site. It's basically like searching for any other job. So you are the one who's researching the different facilities, you are the one who are contacting them, seeing if they have a position available, and then you're applying and interviewing and whatnot. So the placement of this scholarship is treated just like a normal job search. And they give you about 6 months from graduation to find a job, and that's actually a decent amount of time. 6 months from graduation would put me at next month, I believe, and I've already been working for 2 or 3 months, so I had plenty of time to figure that out. Another one is that you can't work in urban or metro areas, and that's not true necessarily. There are underserved areas everywhere, and I was actually surprised at how many highly desirable places to live had a HPSA score, which is a health professional shortage area score, that would actually qualify for me in my year. And so each year you get a different HPSA score, and mine was 17 or above, and there was some in Metro Denver area, and so that was appealing to me, although I went to somewhere else. But that's something that a lot of people ask me as well. They think that you're going to be in the middle of nowhere and you're forced to be there, and that's not true. Underserved could be urban, could be metropolitan, it could be rural, or it could be what they consider frontier, which would be somewhere like Alaska. But there's a variety of places that you can end up working. Another misconception is you can't work in private practice, and it's actually fairly difficult to get that set up as a private practice, but it actually can be done. And my dad is a dentist up in Washington State, and my original plan was to go back and take over his office and work for this scholarship, and I was looking into the requirements to do it. It didn't end up working out, not because I couldn't get the private practice model to work, but because me and my wife decided that we wanted to stay in Colorado. So we didn't pursue that any further, but it is possible. Another one is that you don't get paid during your service years, and I've actually had a number of people assume that since you're paid upfront with your scholarship, that those service years that you repay are done for free, and that's not true. You're getting a normal dentist salary because you're working as a dentist. So it's kind of a double whammy. You get not only free dental school, or dental school that's paid for with a scholarship, but then as you're working out your service years, you're still getting dentist salary, and so that's pretty nice. And then another one is that public health jobs pay poorly, and that's not true. I actually, in looking at different sites for where I could go, there was some pretty good salaries that were being advertised, and it all depends on where you choose to go, where you're looking. Salaries vary pretty widely, but not only do you get good salary, but the benefits are usually pretty competitive as well. And malpractice insurance is usually included in that, free of charge, because you're working in a government-funded facility, and there's more that you can look into on that, but it's the Federal Tort Act, I believe is what it's called. But so that protects you as well. Another one is, will my DAT score or GPA affect my chances? Not necessarily. Your DAT is actually never reported. Your GPA is, but it's not, I'm not exactly sure how much weight that has in the application process. And that's because there's, and I have a link to this website in a couple of slides, or maybe David already went over it, I can't remember. But there's some additional links that I have on there, and one of them is kind of like a rubric for the application process. And it listed on there, it gave kind of scores for different parts of your application and what the application reviewers are actually looking for with these applicants and applications. And GPA, I don't believe, is even on that score sheet, so it may be considered, but it's not necessarily considered highly or weighted heavily. And so for some people who are worried about either your DAT score or your GPA, it doesn't necessarily matter. What they want, like David said, is people who are willing to serve the underserved. And if you make it into dental school and you make it out of dental school, then you're a dentist, and they just want somebody who's willing to be there when they need them. Another one is, I'm not from a disadvantaged background. A lot of people say that. I've heard it over and over as far as people that I talk to. They're asking me what their chances are. They tell me their DAT and their GPA, and they talk about all these different things, and then they say, well, I'm not from a disadvantaged background, so is it even worth it? And absolutely, it's worth it. And I've said this a lot, that I am probably one of the least disadvantaged people there is. My dad was a dentist, and I still was able to receive this scholarship. And it has more to do with my background in volunteering than it does my background. in other ways. So another one is if you want to specialize, should you still apply? I would say probably not. If you think that there's a chance that you could specialize in something that was not on that slide that David talked about, you want to do orthodontics or oral surgery, those things aren't considered primary care, and so that's something that you would not be able to do. And it's not something that you want to get, I guess, stuck in. If you're stuck in this contract for the National Health Service Corps, it's very very difficult to get out of that contract. So if they start paying for your schooling and then you get through, and then afterward is when you decide that you want to take a different route, that's not a good situation to be in. So I would say probably look for other ways to fund your dental school. But if you're interested in public health dentistry, general dentistry, you want to do a GPR or an AEGD, go ahead. Pediatric dentistry as well, those are all considered primary care. And so feel free to look into those, feel free to apply to those programs and to complete them, and then you can just defer your service commitment until afterward. Okay, so here's the information that I was talking about. So the official website, that's going to have most of the information that you want on there. There's an application and program guide on that website. I would highly recommend anybody who's interested in it to look at it. That's where the essay questions are. That's where the fine print details of what the scholarship entails and what the application process is like. The second link is an unofficial rubric, which I was talking about earlier. It's kind of a scoring system. Every now and then that link goes out and I can't get it to work, and then later on I try it and it works again. So if you try it today or in the next couple of days and it's not working, hold on to that link and try it again later, because it probably will pop back up. And then the last one is the available sites that you can look at and see which areas qualify, what jobs are posted right now. I wouldn't get too excited about anything posted now because the jobs are only valid for about 90 days. So that can give you a good idea as to what types of areas, what types of practices, what types of clinics can be available by the time you graduate and start to look for a job, or fourth year and start to look for a job. But I wouldn't bank on anything right now. So, but that's a good site to go to. And I think you would be surprised as far as how many different areas, how many different types of clinics there are. And for me, it was very reassuring that there were so many options as I was applying for this. And then once again, as I was actually applying for job searches. So this is David and my information. Feel free to write down our emails. Feel free to contact us if you have any information, and we're more than willing to help proofread essays. I'm sure I haven't asked David if he was okay with that, but I'm sure he's fine with that as well. So let me switch on over to the next presenter.
All right, here we go. Let's see. I'll move this back. I want to get some out of the way. All right, there we go. Can you see everything? Everything disappeared on my screen. Just want to make sure I can be seen. Okay. All right. That's neat. I learned something about the National Health Service Corps. I didn't really know anything about it. So this is pretty nice. I think the Health Profession Scholarship Program and Health Services Collegiate Program are a good complement to the scholarship previously mentioned. There's nuances, I think, about both, but this one might answer a few questions, but also kind of give some complementary options, because there are some benefits, I think, to this that the other one didn't have, as well as vice versa. So to start, both the HPSP and the HSCP are military scholarships. You will be working for the Army, the Navy, or the Air Force. So to start, the Health Profession Scholarship Program, this is the scholarship that I got from the Navy. I structured this similarly to the last scholarship. So there are 4- and 3-year scholarships available. If you're going to apply for the 4-year, just apply the same time you would apply for your ADSAS application. For the 3-year, you would apply in your D1 year. So just note that your GPA in undergrad will matter for the 4-year, but then for the 3-year, your GPA in dental school will matter. Tuition and fees and a stipend will be provided when you get the scholarship. So it's similar to the last one. All tuition is covered. There'll be some fees that you'll incur in dental school that aren't covered in tuition, and that'll be covered as well. You get a little bit more of a stipend, about $2,200 a month, and that's about standard for all 3 branches. Note that when I'm talking about this, there's an HPSP scholarship for each, the Army, the Air Force, and the Navy, and they all differ by a little bit. So around $2,200, maybe it's $2,000, maybe it's $2,300, depending on the branch, and it does kind of change year to year. And this scholarship as well gives job security. So you're all probably pre-dentals right now, but if you can think forward into your D3, D4 year, when everyone's kind of looking for a residency, all that stuff, you know exactly where you're going. You're going to be getting paid. You're going to go practice and do exactly what you want to do. So in addition to tuition being completely paid for, you get a $20,000 sign bonus, and that's awesome. It's real. You get every cent of it. I got it, and it's a really nice incentive to tuition being completely paid for as well. So let's see. So reimbursements, things just like type on teeth, textbooks, all that stuff is usually covered. It's not everything. I think something like required, if a school requires scrubs, for you to get custom scrubs. They actually won't cover that. Some things have changed. It used to be that, but now it's changed. So there is a handbook for this all, and I'll give one of the links at the very end. It'll have everything that's covered, everything that's not covered. It's really long, but it has all the information. So again, this is a year-for-year service repayment. So they pay for 4 years of dental school. You give them back 4 years of serving as a military dentist. So now the HSCP, the Health Profession Scholarship Program, HPSP, and the HSCP, the Health Service, what is it? We have Health Service Collegiate Program, Health Services Collegiate Program. Yeah, so it works the same, 4-year or 3-year. This one is just the salary. It doesn't have tuition. Tuition's not completely paid for. You don't get the $20,000 signing bonus. So you just get a salary. And I'll explain how you essentially become an officer during dental school. So that's where your salary is coming from. You're getting paid to be an officer for the HPSP and as the HSCP, except for HPSP, you get tuition paid for, and you get the salary, but HSCP, just the salary. So you're making money in dental school. It's not a bad gig, but you still, you're going to have to take out loans for dental school as well. So this, essentially how this one is kind of structured, it's an alternative to the HPSP in case you don't get the HPSP, in case you're rejected for it. So when you apply for the HPSP, your recruiter is going to say, hey, we're going to sign you up for the HSCP as well. If you don't get the HPSP, we still have this offer to give you. Now, whether or not it's worth it to you to continue on with just getting salary with no tuition paid, that's up to you. If you want to back out at that point, I think that's a good place to reconsider. But also, if you are a former enlisted service member, then you actually cannot get the HPSP. HPSP is more of an incentive to get private sector citizens into the military. And so the HSCP is then your only option. So you will take that over anything if you are prior enlisted. All right, so now from here on out, I'm going to refer, if I say HPSP, it's mainly just because That's what I have, and that's kind of what I'm just used to calling it. If I'm talking about anything involving what serving is like when you graduated dental school, when you're actually in the military, know that that applies to both if you're applying for the HPSP or the HSCP. However, I will try to make the discrepancies if I'm talking about it beforehand and the benefits and stuff like that, whether it's HPSP or HSCP. So to apply for either one of these, essentially you just apply for the HPSP. If you don't get the HPSP, you have the option for the HSCP because the HPSP has the benefit of having tuition completely paid for. That's why people apply for it. So you want to contact a local recruiter, and again, you can get the HPSP for the Army, HPSP for the Navy, HPSP for the Air Force. So I applied for all three. I was accepted to the Army, I was accepted to the Navy, and I was rejected from the Air Force. So I got to choose between the Army and the Navy. I chose the Navy. It's a lot of work. We'll get onto the application requirements, but you're going to have to go to a Navy recruiter and apply there, or go to an Army recruiter and apply there. You can't just apply for all three. It's not like a common app, or it's not like AdSAS. It's not one thing. You're essentially going and signing up for the military, which is kind of more of a process than just signing in one form. So you're gonna have to go talk to a recruiter and make sure that they know that you are applying for the Health Profession Scholarship Program because you are going to dental school to become a military dental officer. Most recruiters are there to sign up enlisted, so that's soldiers, infantrymen. You don't want to waste your time with that. They don't want to waste their time with you because you're not that's not what you're going for. So make sure you have them refer you to a military health services recruiter. The application will be due around October or a little bit earlier. If you have a high DAT GPA combo, maybe around like a 21 DAT and maybe like a 3.5 GPA, or maybe like a 3.4 and a 22 or something like that. A combination around there, you might be able to apply earlier. But just know that let's see. So scholarships are awarded in early January. So if you want to apply, I would say start applying in January, a whole cycle before. So you have a whole year, to work on it and get everything done. Because there's a lot that kind of comes in waves. You don't really have control over when things come, and neither does your recruiter. I'll talk a little bit more about how your recruiter kind of plays into it. But yeah, you want to give yourself a whole year in advance to start working on it. There's a lot of stuff to go through. There's a lot of paperwork, and there's a lot of obstacles, hoops to jump through. So again, just remember, you'll be making money in dental school when no one else is. So this is a really nice scholarship to have. So one thing that the HPSP provides that I believe what the National Health Service Corps didn't provide, so that was the non-military one, the government scholarship. So you actually do have a higher chance of specialization if you serve in the military as a dentist. So I'll talk on that a little bit later. I've got a chart with all the statistics for how many apply and how many get accepted for each specialty and whatnot. It varies, but it's a huge benefit. If you're thinking about specializing and you will do whatever it takes to get there, you should definitely consider going to the military and doing your specialty through them. They do have there's a military dental corps. They have their own schools for every specialty. So definitely consider that if you're thinking about specializing. So starting salary as a dental officer, about $70,000 to $90,000. That's about what you'd make as an associate dentist coming out of dental school, going right to an associateship under somebody in their private practice. So it's not a bad gig. Again, you're coming out with no debt. You were even making money during dental school, so you're leagues ahead of everybody else. You're just working on a military base. So how it kind of works is, this is kind of where I'm at right now. During dental school, you have the rank of ensign. That's a Navy term, so that's a Navy rank. You're an O1, so it's the first grade officer. So it's not called an ensign. The first grade officer, an O1, is not called an ensign in the Air Force or the Army. It's a different term. But you're an O1, whether you're in the Army, Navy, Air Force, while you're in dental school. This is where you kind of get your benefits. You're essentially in the military now. You get the benefits of being in the military. I've got some benefits on the next page, but that's how they're paying you the salary and all that stuff. So you are an O1, you are an officer of the military. Once you graduate, you immediately become promoted to officer grade 3. So in the Navy, it's a lieutenant. I believe it's like a captain in the Army, and it might be something different for the Air Force. I'm not sure, but you have an O3. That means increased pay, and all this other stuff. But you move right up. You're you're a health professional. They want you. You're important to them. So some of the benefits that you'll receive. You get military health care, so TRICARE, that's what it's called. That's covered for you and your family, and family is you, your spouse, and your children. It doesn't count for your parents and stuff like that. There's like insurance plans and things like that. I think maybe some investment options. I can't really remember. I haven't really looked into it too much, but you do get benefits while you're in dental school, so that is also an added bonus. So you do have to complete a 6-week officer training course prior to serving. So whether this is, I've got down at the bottom of the description there. So it's kind of flexible. So in the Army, they want you to serve before you go to dental school. So you'll do the 6 weeks, the summer before dental school, and you're just learning to salute, military history, etiquette, how to be, an officer, how to, serve as an officer. There's some physical fitness training. I'll talk a little bit more about that later, but it's not boot camp. I'll talk about more on misconceptions. A lot of stuff's coming later, but this is not boot camp. You're an officer. You're going to officer development school. This is not enlisted training. You're not enlisted. You're an officer. There's a difference. They want you. It's not the other way around. So they're going to, they're treating you well. It's not, you're not just eating dirt. People aren't yelling at you and stuff like that. They respect you and, treat you as the, future dental professional that you're going to be, because they want you. They're trying to, bring you in and, have you serve for them. So let's see, stationing location. So this is, I kind of jumping around a little bit here. So this is after you graduate dental school, where this is where you'll be stationed. So it's a matching process. You could be stationed overseas. I think that's very unlikely nowadays, I think, because there's not that many military occupations in the world right now. There are some established bases in Spain, Germany, let's see, Japan, and I think South Korea. Those are some common ones. But more than likely, you're going to be in the States. I think maybe 80%, 90%, don't quote me on that, but it's highly likely that you're going to be in the States. And it's just, they'll give you a list and you select the preference that you want, from maybe 1 to 10, and then they'll do their best to match you up. So it's not entirely in your control. You have to be ready to kind of go wherever, but they do consider where you'd like to go. All right, so this is how I was talking about how the military has its own dental residency. So it's called the Military Dental Corps. I think it's all under the branch of the Army, however the other branches operate through them. Anyway, you can get an AGD, which is a 1-year in general dentistry schooling, just postgraduate school, an AEGD, advanced education in general dentistry, a GPR, specialty in perio, prosto, oral maxillofacial surgery, endo, ortho, pediatrics, and public health, as well as oral maxillofacial pathology. So you can specialize in all these. You can do that. So how this works is, say you get the 4-year scholarship, you have then 4 years that you're expected to serve. If you apply for any one of these specialties and you get it, so let's say, I don't know, endodontics, say it's a 2-year residency, so that's, it's not 2 years added onto your 4 years. Since it is through the military again, it's going to be 2 years in endo school in the military, and then you still have 4 years after that to serve your initial HPSP, I guess, commitment to serve. However, this is good, and again, as I said, the military wants you. It's easier to specialize in the military than it is just in private school, private schooling and stuff like that, or I guess civilian, sorry, in civilian schooling and stuff like that. So They want you because if they can get you to serve as an endodontist or an oral surgeon or something like that, they're getting you guaranteed for 4 years as a dental specialist rather than as just a general dentist. They get better quality service for their time. They would prefer that. This is why it's, it's easier, I guess, to specialize in the military. They want to make that happen for you. You want to specialize. They want you to specialize. They get better service when you do specialize. So this is just an overview of kind of the benefits of that. The most, I guess, that they would want is oral maxillofacial surgeons. So in civilian residencies, you have a 1 in 40 chance based on the amount of people accepted per the amount of people who apply. In the military, it's 1 in 2. So 20 people apply, 10 people get it. It's I mean, those numbers speak for themselves. That's incredible. If you're thinking about doing oral surgery, this is definitely a route you might want to consider because everything else, nothing else, I guess, is as good as a 1 in 2. But all of these are even better. I mean, endodontics 1 in 17 in civilian, and it's 2 in 5 in the military. Things like orthodontics 1 in 31 in civilian, but then 1 in 4 in the military. Now, again, this is not to say that you don't have to be competitive, because those who are already getting the HPSP are going to be, somewhat competitive from the start. But once you get in, understand that there's a much smaller military pool of applicants than there are in the civilian world. So while the chances are greater, the pool is, a lot smaller. So there's a lot more variability in, I guess, the average applicant for these. So maybe you get lucky and it's easy, but it could also be just as hard. So, don't bank on it being a sure shot, but it's definitely way better than just applying in for a civilian residency. So some common misconceptions. This is the military, and I think everyone's perception of the military up till now is, fighting, guns, war, whatever. You're not serving as an enlisted infantryman. You're not going to be fighting. You're not going to be picking up a gun even. I've went on base on Air Force bases, Army bases, and some of the dentists who were serving their HPSP commitments, they were never even trained to handle a firearm, because you wake up in the morning and you put on your military gear, you go on base, you change into scrubs, you're in a really high tech, nice dental office, and you treat patients, and your patients are all servicemen and women. And that's just the only difference. Instead of treating civilians, you're treating members of the military and their families, other officers, anybody who's going to be on base or affiliated with that base. That's your patient base, because the United States military needs to have all of their men taken care of. Health, dental, you name it, they need people to do that, and that's where you come in and serve your part. So that's what it is. You're not fighting. They're not going to put you on the front lines. If we go to war somewhere, you're not going to be like all of a sudden be like, oh, we need men and you need to fight. That's not going to happen. You're there to serve as a dentist. They're not going to make you go fight when they need you as a dentist, because no one else can do what you can do, but they have a million people that can fight. So just understand you're not risking anything of doing that. Now, if there were some military occupation in the future, that could change where stationings could happen. You can't, if you're in the Navy, you can get stationed on an aircraft carrier per se, or overseas it might become more common or something like that. But I talked to an Army captain, I don't know, maybe a few months ago, and she had said that there is a list for getting stationed in areas of active combat, and there's a list to get on that. And it's not random. You have to volunteer to do it. And she volunteered, and she couldn't even get on it because there weren't enough active, combat situations in the world right now. Anyway, so that's kind of just gives you like an inside look to what's really going on in the military. There's not enough places going on that have active combat, so therefore just don't even worry about that being kind of a concern. However, the world's in a changing environment. That can change in the future. Just understand that's kind of, what you're getting into is, not necessarily certain, but again, they prioritize you. You're going to be a dentist. You're not going to be fighting for them. So you don't have to worry about that. Okay, so during dental school, you don't have any service requirements. You'll get, you might hear about some. That's not entirely true. However, how it works out is if you get orders to go anywhere, do anything, serve on active duty or anything, all you do is just say, hey, I've got orders to go to school. I've got school orders because you're paying me to go be a dentist. So if you interrupt my schooling, I won't become a dentist. They understand that. So if you get any orders whatsoever, you just have this, trump card, you lay it down, and it's like, I'm just going to school, and I'm going to continue to do that. And they're like, okay, yeah, you're right. And so you don't have to worry about that. The only thing you do is just worry about, what to spend that check you get in the month, check you get in the mail every month. So that's just about it. So again, they want you to succeed. They'll give you, the financial benefits that that you might need. They're paying you to go to school. They're not going to try and interrupt that. And again, you're not going to go to boot camp. You're not going to have a boot camp experience. No one's going to yell at you or whatever. There's no going to be no drill sergeants or anything like that, so you don't have to worry. All right, so application tips. Let's see. So assume the academic expectations are similar to dental school. If maybe a little bit higher, but also it doesn't necessarily have to be that, because there are some other components such as leadership, professionalism, physical fitness, and stuff like that. They can kind of counterbalance it. So that's not really in the ADSAS application. However, if you have leadership, things like professionalism and physical fitness, those all kind of help. And it's kind of like an abstract, some abstract strengths there. Leadership, is really easy. They love to see that. But stuff like professionalism, when you're going to work with a recruiter, and this kind of goes down lower in the page, how your recruiter is responsible for your application. You're not submitting it yourself. They are completing the application about you, and then they submit it to higher-ups, and the higher-ups decide on whether or not you're a good candidate or whatnot. So it's kind of frustrating because you're not in control of your application. You go and, they give you forms, you fill them out and give them back to them. Then they have you complete some other things, and, you get back to them. And they submit this packet about you that goes to the decision board, and they then make a decision on whether or not they're going to take you for the scholarship or not. So things like professionalism and physical fitness are really important here because, they're looking for some subjective things here as well. Are you fit to be an officer? Do you look like you're officer material? Do you have, respectable nature and stuff like that? Every time you go into your recruiter's office, you're looking nice. Your hair's not messed up. I had a beard and a ponytail, before I started to apply, and I wanted to do this. So it's like, all right, time to get, maybe cleaned up a little bit. And so, professionalism is important. They imagine what you look like in a military outfit and stuff like that. It's like, do you fit the bill? Does that work? It's like, can we see you in there? All that stuff kind of factors in. Physical fitness, can they take one look at you and be like, oh man, you're gonna have a tough time, meeting the fitness requirements, or oh, you respect, the fitness, standards of the military. You're gonna be fine. Kind of like that. The more things you can get in your favor, the better, for sure. Those things do wonders. So at Officer Development School, there is a fitness test. Now, you may read about some other fitness requirements and stuff like that. However, that doesn't apply to you because you have a special case. This is the HPSP scholarship. You're kind of going in. You're other officers going from enlisted to officership that are still kind of saying in the military side of things, well, we're in the healthcare side of things. They're going to Officer Candidacy School, OCS. We're going to Officer Development School, ODS. So it's a little bit different. And so something you might be concerned about is fitness testing. The way that's different is there's a push-up requirement, there's a sit-up requirement, and there's a 1.5 mile time. You can go online, and the link that I'll have will have the handbook that I believe has those numbers, but it's kind of a scale of a grade, not just like a minimum requirement. I'm sure there is a minimum requirement, but it's more of like a poor, bad, good, excellent, exceptional sort of deal with all that stuff. I would shoot, I don't know, just to give you a ballpark right now, maybe 30, 40 push-ups could be like passing. Sit-ups, it might be like 50 sit-ups. And it's 2 minutes. Push-ups in 2 minutes, not 1 minute, I believe. And sit-ups, I believe it's 2 minutes as well. And a 1.5 mile time, maybe like 7-minute mile pace or something like that, maybe 8-minute mile pace is passing, so maybe like 11 minutes or something like that. So more about the application process. It's a lot of paperwork. I applied for all three. It is a ton of paperwork. Just doing one, it's not bad, but there's some things that they're just really, really annoying to do. I think I have them on the next page, so I'll be getting to that. But yeah, they'll give you forms that get outdated. You have to fill them out again. It can kind of be a nightmare. And so yeah, bureaucracy can be inefficient at times. And I'll just say I've had some bad experiences with recruiters and stuff like that, and it's just like they'll call you in the middle of the night, and it's like, hey, this needs to get done by the end of tomorrow. It's like, and you're just like, I asked you if you need to do this or if there's anything else I needed to do, and they're like, yeah, I know, but this is just reality. It's like, we messed up. You got to do it, and you got to do this all professionally with a smile on your face. Yes, sir. No, sir. Yes, ma'am. No, ma'am. Because again, if you act poorly, that kind of reflects badly on you, and you're not submitting your application. Someone else is submitting it on you, and they're giving their word as well. So how well you work with them, if there's hardships and stuff, and you kind of roll with the punches, that will reflect very well on you in the end. So if you plan to apply for more than one, this will increase your chances of getting accepted for sure. However, it's kind of difficult to do that since there are 3 branches you're applying to. They're all proud institutions, and it's not just, hey, I'm applying to this dental school and this dental school and this dental school. It's, I'm applying to the Navy, or I'm applying to the Army, and they're looking for passionate applicants, someone who is dedicated to serve. They've got a history of service in their family maybe, and it's like, say they've all been Army, and it's like, oh, but you're applying to the Navy too? It's like, what's up with that? That's kind of odd. So they're going to ask about it, but you kind of have to put it in a way that caters to everyone, but still is honest, to kind of remain or keep your integrity there. So one way that you can phrase it is say, I'm applying to the Navy, and if you're talking to your Navy recruiter, say, well, I'm also applying to the Army, except, that's my second choice. If I get the Navy, that's great, but if you guys don't accept me, well, I need to have a backup, because if you guys don't accept me, that's fine for y'all, because you guys have more candidates, but I still need a backup. So I'm also applying to the Army, so I kind of need that help. So that's one way you can phrase it, and then just kind of, switch who is like, oh, well, you're my first choice, but they're my second choice, depending on who you're talking to. It's kind of hard to do it. You just kind of, that's kind of just what you got to do if you want to apply to all of them. But this is your decision. You're applying to where you want to go, and you're trying to, make your future. So you have every right to apply to more than one. All right, so the requirements, there's an initial interview questionnaire. It's kind of just like, we're going to get a little overview about you. They do, a drug question, like, do you use drugs and stuff like that? And, have you ever, are you committed a felony or something like that? So that they just want to get that out of the way so they know, they can stop wasting time with you, or like, okay, you're a serious applicant. When in doubt, always be truthful. Some of those things will decline you from everything, but just keep going to see, how far you make it, but it shouldn't be a problem for most people. When in doubt, talk to your recruiter, about anything to see, like, all right, is this okay, but this is not okay. If there's any kind of questionable background history you have, there's a government background check. This is a 68-page form. I filled it out 3 times, and it's too much fun. So just no paperwork. There's a ton. There's a lot of things that I haven't listed here that are just minor forms. Again, remember, you're enlisting into the military. This is, the government as well. They want to know everything about you. There's a lot of stuff to fill out. So there's minor forms that you're going to get. They're, a combination of letters and numbers, and I couldn't even, recall what they're named, but it's just, a lot of it's going to be repetitive things. Just keep rolling with it. There's sort of like a personal statement, like essay. They don't really have, it's the same thing as, applying to dental school. There's no real criteria for it. It's just like, state your purpose of intent for applying to health profession scholarship program. And you got to come up with something. Honestly, something along the lines of your personal statement is going to be pretty good. However, you definitely want to add in things about leadership, things about, understanding, kind of the call to duty to serve your nation. You see what the benefit, America is getting from coming in to serve, the servicemen and women and stuff like that. So definitely add that aspect to it, because that can only help. Letters of recommendation, I think you can submit 4. I think that's what it is. But again, your recruiter is, he's experienced in, he or she is experienced in submitting these applications. They know what people have done that has worked, that have gotten the application. They're on your side. It is, pretty helpful to have someone else, help you with this that are on the inside. So you can actually submit to them 8 letters of recommendation, and they'll be like, oh, I like this one, and that one. Those all look good. Even though you may not have ever seen the letters of recommendation before, they don't care. They're going to read them because, again, if you get accepted, it looks good on the recruiter because the recruiter found a really good applicant. So they want to help you. They want to work with you, and they want to be, they want to make sure that they're submitting the best application that you have because they get some sort of, compensation for submitting someone well. So letters of recommendation, I would say, again, hard sciences or something like that you took in undergrad would be good here. The same ones you would likely use for your ADSES application in your dental school. However, if you can find someone, in the military as high, it's really as high ranking as you can, because that's kind of how it goes. It's, rank kind of trumps all. So if you can find someone high ranking, if you can find a former dental officer, honestly, that is your golden ticket. Not your golden ticket, but that is as good as a letter that you can get, because it's got the military, influence as well as it's got the dental influence. So maybe look at your local dental school, and I'm sure you'll have at least one military dental officer or former retired, serviceman or woman. So definitely look there. That's basically letters of recommendation. Shoot for those, see if you can get that. Let's see. So full medical history report. Yeah. So anything, you broke your arm, when you were 12 or something like that. You had asthma or something like that. These are all things that they're going to want to know. They're going to check up on it. It might seem like initially they just ask for, just your last 10 years or something. They're going to end up asking for everything. So go to your primary care physician. They're going to be, you better get good friends with your primary care physician. I don't know how many times I went to them and said, hey, we need to do another physical, or I need to get this done, this sort of test done to prove that, I had to prove that my asthma had gone away or something. I had childhood asthma when I was like 10. And they still were like, no, we want to know more about that. Like, do you still have asthma? So I had to go get, pulmonary function testing and stuff like that. So, there's a lot of hoops you got to jump through, and the more, diverse your medical history is, the more, forms you might have to complete, the more tests you might have to complete to show that you are, physically fit to serve. So, MEPS, I can't remember what it stands for, but it's essentially the military, medical entrance processing center, something like that. Essentially, this is where all enlisted and officers go. Essentially, if you're coming to the military, they go to perform their own physical on you to see, if everything's fine and stuff like that. Essentially, if you spend 6 hours at this medical center in your underwear doing you walk funny and stuff, because they want to check your joints and all that stuff, because it's like, you're going to be in, you could be in combat gear. You're kind of thrown in with everyone else. So while they're checking people who can serve in harsh environments and stuff like that, you're kind of just lumped in with that. But yeah, you get a physical by a military dentist, or sorry, not dentist, military physician. They check you over to their standards and whatnot. So it's a long day. You get there at 6 a.m. and you're not gone till 1 or 3 or something like that. But it's just a really long day of testing. All right, so application stats. So this is for applying to, this is the HPSP, not the HSCP. So applying for the HPSP, let's see. So for the 4-year scholarship, the Air Force, they take 12 applicants. Now again, these numbers kind of change from year to year, but it's about 12. That's not much. You're applying against everyone in the United States. However, there's not that many. I think maybe around 200 might apply for the 4-year scholarship for each. That might be a good number to think. So 12 out of 200. The 3-year scholarship, the Air Force, however, take more of. Now for the Navy, it's flipped. The Navy takes more 4-year scholarships and they take less 3-year scholarships. So there's 61 in the 4-year, and then there's about 18 in 3-year. So for the Army, it's a lot more for the 4-year scholarship, and I'm not really sure about the 3-year scholarship. However, from what I've heard, they do not max that number out ever, or I guess frequently. So when in doubt, maybe apply to the Army to get, almost not a guaranteed acceptance, but they usually don't meet their quota. So that's just something to think about. All right. So here's some more information. The official website here for the Navy. This is the Navy HPSP. I don't have the links for the Air Force and the Army since, after the application was done, I did not continue with either of them. So if you go to this first link, the accessions page, this is everything you need to know as, if you're going to be a Navy HPSP. Essentially, it would be about the same for the Army and the Air Force. However, you're going to get all this information from your recruiter once you start talking to them. Again, talk to them as soon as you can. So go there and check that page out. That'll answer a lot of things of like what's covered on tuition and stuff like that. There's a video here about Officer Development School. Again, this is the Navy's branch of Officer Development School, so it's going to be similar, maybe slightly different for Army and the Air Force. This last link, a fun video. I think you'll appreciate it. But that's all I have. I'm going to turn it back over to Brian, I believe. First, if you have any questions, this is my contact information. Feel free to write that down, send me an email. I'm sure we'll send out that info afterwards. But we'll be hanging around, so I'll answer any questions you'll have. You have those, just enter them into the box.
Okay, we'd like to open up the program to your questions. We will do our best to answer them all, but if we don't get to yours, you can email it to either David, Kyle, Andrew, or myself after the program. You can enter your question into the box and it will be answered in the order it was given. Thank you. Panelists, we have 8 questions in the queue, so if you want to start with the first one, unless it was already answered.
So the first question is, during the 4-year service commitment for NHSC, do we get a salary to cover rent, food, and other bills? Kyle, I think you can attest to this firsthand.
Yeah, so you don't get a salary, but that's what we were talking about when we mentioned the living stipend. And so for the National Health Service Corps, it was about $1,330, so $1,330 before taxes, and that is taxable income. And so you have to make sure that you understand that federal taxes is coming out of it, and then if you owe state taxes, you have to pay that. Usually you can just do that. It's not, well, it wasn't too much for me in Colorado, but that's something that you have to pay when you file for taxes. But yes, it covers a good amount. I still had to take out a small amount of loans every year just to make ends meet, and I actually also drove for Lyft to help out with that. But yes, it covers most of it.
And then after you graduate, so that's for the 4 years during the scholarship when you're in school. Then after you graduate, NHSC, to my knowledge, doesn't give you any additional salary or funding. You just are getting the salary that you're getting paid by the clinic that you work at. And you can also consider the benefit of the scholarship sort of like as added to your salary, because the tuition, the fees that you get during your 4 years in dental school, the scholarship funding, that is tax-free, the tuition and the benefits other than the stipend.
We're on to question 2 now?
Yeah.
All right, so question 2, let's see. I believe this was asked before I started talking, and I think I covered just about everything. Talked about the scholarship, talked about requirements, physical fitness requirement, academic requirement, essay requirement. All right, and then it said, should you be an ROTC? So that's actually a good question. I was considering doing ROTC for undergrad. However, from what I talked, I talked to a recruiter and they said, it doesn't really change much. So I just thought, why worry with it right now? It might give you a benefit, again, on the professionalism, leadership, prior involvement with the military. It could give you some benefits there, but I'm not sure. Let's see. All right. So a few of my friends in my class right now, they went to VMI, so they were part of the military academy, and they did get the HPSP scholarship, so they were still qualified to get it. So I'm pretty sure if you're an ROTC, you're still able to get the scholarship. However, I'm going to jump just to question 6 right now because it's relevant. They asked, let's see, if do enlisted soldiers get some sort of advantage for HPSP? So as far as I know, one of my classmates, he served as enlisted for like 6 years or something like that. He told me that he was not eligible to get the HPSP scholarship. He was only eligible for the HSCP. However, with the salary, that's just his salary that he was getting, so not tuition, not the signing bonus or anything like that. However, I guess he got his salary plus his you get bonuses for however many years that you have served. So it's more than just the baseline salary. However, that's something you're going to have to ask a recruiter. They're going to know specifically. But from his story, he was enlisted. He was not eligible for the HPSP scholarship.
The third question. Oh.
Yeah, go ahead, David.
I was going to say the third question is, are all jobs in the U.S. or also abroad? For NHSC, it's all in the U.S.
So there's also some U.S. territorial areas that you can go. So I guess it depends on what you consider as abroad. But yes, they're within the United States, but not necessarily the continental United States, if that makes sense.
So would Puerto Rico and like Guam, would those qualify?
I don't want to say for sure, but yes, I know. What is it? I think it's the Marshall Islands. I know somebody who did their 4 years. They just barely finished, and so that qualified. So I would imagine Puerto Rico probably would. So, and I'll also talk about question 4. It says, for National Health Service Corps, would the salary be funded by the government? If so, would there be any difference, salary benefit policy insurance wise versus having a private practice? So it depends on how the place that you are working is funded. So me specifically, I believe about 70% of the operating budget of the year comes from the government. And so, yeah, my salary comes from that. And any difference? So I would say probably the benefits are better than private practice as far as health insurance goes, malpractice, disability insurance, life insurance. That's all included in my gig right now. Salary probably on the lower end, but there is room to grow. And I'm actually right in line with some of my classmates who went and they're being associates right now at a private practice. So it's really not that bad at all. And because clinics usually, I think one of the actual requirements to be a qualifying site to work out for this scholarship, you have to have some sort of sliding fee schedule discount program. And for me, that's been a huge help because you don't have to worry about the insurance companies. You don't have to worry about people not being able to pay because there's some workarounds with that. If they're not on Medicaid or in your state, the Medicaid doesn't include dental, then there's other ways that you can get them the treatment that they need. Whereas in private practice, you really have to ask them to find somewhere else or try and finance it for them through payment plans. But so I actually really like that aspect of it.
Question 5 is, can international students also get the scholarship? For NHSC, you must be a U.S. citizen or you must be a U.S. national to be eligible to apply and get the scholarship. So U.S. citizen can also include naturalized citizens, or if you're born in Puerto Rico, Guam, U.S. Virgin Islands. A U.S. national, I just looked it up. Interesting enough, a U.S. national is someone who has been who was born in American Samoa. So, but I don't think unless you're a U.S. citizen or U.S. national, you're not eligible for an NHSC. Andrew, could you elaborate on the military scholarships, maybe?
Oh, yeah. What was the question on that?
The question was, can international students get the scholarship? And for NHSC, you have to be a U.S. citizen or you have to be a U.S. national to be eligible for the National Health Service Corps.
I'm pretty sure, since it's the military, I'm pretty sure you have to be a U.S. citizen, because I just don't even think you can like get into the military and by any other route unless you are a U.S. citizen. You talk to a recruiter again. All my answers are going to end in talk to a recruiter, but I'm pretty sure that's true. All right, so are you done? We're going on to question 7. So I'm going to do questions 7 and 10 together because they're similar. So question 7, sorry I wasn't repeating questions earlier. So as a Navy officer, will they have you deploy with ships and go underway for several months? And then question 10 was for HPSP and HSCP. Do you have any say in where you work post-school? So for the Navy, just know that where are Navy bases? Wherever there's water. So you're not going to get stationed in, I don't know, Nevada. You're not going to get stationed in Colorado. They've got bases in Bethesda, Maryland, Norfolk, Virginia, the Great Lakes, California. San Diego is a very common one, and Hawaii. Those are some really big United States ones. As I said, there are other ones, but internationally, those aren't really. Again, I don't think they're that common. I think the chances of you going there are low. But if you're one of the ones who you want to go serve, on a U.S. Navy base or an Air Force base in Germany or something like that, or Spain, and you want to, and you put that high in your prioritization list, because you get a form and you put in, I prefer to go here, 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 and here, in that order, and say number 1 is Germany, you're probably going to get stationed there. I think most people are going to want to stay in the States. So those who choose to go, outside the U.S. will be able to go. So you do have a say. And in the end, you will be stationed wherever they station you. So if you don't get your top pick, that kind of stinks. Depending on where you go to specialize, and I guess this is something I meant to say earlier, depending on where you go to specialize, there are special bases in which they only have that. So I know for the Navy, all the specialty programs are in Bethesda, Maryland. So, if you want to go specialize right after school, your first station is going to be Bethesda, Maryland. From there, they're going to station you elsewhere. And one thing I did mention is that going through the military, they do want you to specialize. As I stated earlier, however, almost, they're going to want you to at least do an AEGD. So if you plan to get tuition paid for by the military, serve your 4 years and get out, you can do that. And they're not going to trouble you with that. However, if you plan to maybe consider a career in the military, they want you to go through that AEGD program. So you'll get that 2 years of advanced education training in general dentistry, almost guaranteed if you want to do it. So take those 2 years and you go, get that AEGD and then go serve your 4 years with that advanced education training and then get out, maybe. But you get that advanced education training almost by default. Every single dentist that they can get to go through there, they will do that because they want that advanced training. They know there's some things you don't get in dental school. They know there's advanced things you can do in dental school. So just another, thing about specialties there.
I just want to jump in real quick and correct something that I said. So I said the Marshall Islands. I was close. I just looked him up on Facebook to see where he was and did his service repayment. And it says Commonwealth of the Northern Mariana Islands. So, yeah, just making that correction.
So question 8 was, if I apply for either the Navy or the Air Force, will I go through OCS or ODS having a professional degree? So I assume this is for someone who is already, say, a dentist, or if you choose to go through dental school and then apply to go do a residency in the military or to serve as military dentist. If you choose to forego the scholarship or you're already on the other side, you have your degree, you can do that, and it's a little bit different. It's a little bit the same. Going through the military or going, you're going to have to fill out the same, huge forms and stuff like that. There's a lot of the same paperwork. You're going to have to go to MEPS. You're going to have to get the military physical. You're going to have to, you will have to go to ODS. You have to get officer training because, again, that's more of just indoctrination into the customs of the military, understanding etiquette, for the very least that. Physical fitness requirements still stand. Officers of every rank, no matter how high you go up, generals too, whatever, they've got, fitness requirements. Their standards are way more lax because they're super high up and make the rules, whatever, but you will get promoted much faster and if you hold yourself to the same standards that everyone else does in terms of physical fitness. So there is, again, how the path is a little bit different. You don't have to do the essays. The interviews are a little bit different. From what I remember, they always said, if you already have a degree, contact someone, special for that. So I think it's a lot more lax. You have a much better chance of, getting into the military at that point because they're not paying for your tuition if you already have a degree. And there's not that many applicants for becoming a military dentist, at that point that already have their degree. So it's a lot easier. And you already have a degree. They want you because they don't have to waste any time. You can hop right in and start treating people. So that process is definitely a lot easier.
The question 9 is, can you tell me more about the HRSA scoring system? So to clarify, the National Health Service Corps, your service requirement must be served in a certain HRSA scored area where the need is high. So health professional shortage areas, or HPSAs, are the areas that HRSA, which is the agency, the Health Resources and Services Administration, that's a government agency that designates HPSAs and these shortage scores. So these health professional shortage areas, they can either be a sort of, the different categories are healthcare provider shortages in primary care, in dental care, or mental health. And then these 3 types of shortages can be a geographic area. So that means the number of, for example, dentists for the population in that area is a shortage. So they take the number of people that live within a geographic area, so like a census tract that they use for the US Census, divided by the number of dentists. If that's below a certain number, that gives the geographic area score. Or if there's a population where you have a specific area where there's like a large population of migrant farm workers or low-income individuals or other groups, that can be designated as a type of area. And that the actual, like a health department, like a county health department, needs to apply for that designation. Or it could be a facility. So that could be, like Kyle said, it could be a correctional facility, such as a prison or youth detention center or a state mental hospital. So or it could be a automatic facility HPSA. So that could be the federally qualified health center. So these are health centers that Kyle mentioned that get funding from the federal government, or they could be Indian Health Service. So either IHS hospitals or tribal hospitals. So there's a lot of variety in sort of what sites are eligible for NHSC. And there's a lot of different factors that go into sort of making sure that all of these populations and individuals from underserved areas that need care are taken care of.
All right, I can handle one if you guys are looking at another one. So question 15, in regards to the HPSP payback, is it 4 years of active plus 4 years of individual, what is it, ready reserve, I think? Yeah, individual ready reserve, which is just after you retire from the military, I believe you're just on reserve duty. So is it 4 years active, 4 years individual ready reserve, or is it 4 years active plus 4 years? I think it's the same thing. Anyway, they pay for 4 years for you to go to school, you go serve them for 4 years, and you get out, and that's it. You're not on individual ready reserve, so it's just four for 4, and that's it.
Another question is, what are options for students entering advanced standing international dentist program? So this is similar to what we mentioned earlier. Unfortunately, the eligibility requirements for NHSC and most likely HPSP and the military scholarships is that you need to be a U.S. citizen. So if you are an international student that does not have U.S. citizenship, you would not be eligible for these scholarships. However, I do encourage you to check out the ASDA resources for international for advanced standing students. There's a whole international dentist and advanced standing student committee that ASDA has, and at the national level, and I highly encourage you to check out the resources on the national website for ASDA, and also check out information for this committee, and potentially reach out to the students that are on that committee, and they would be able to best help you for scholarships. And sort of related to another question that was asked is that sort of other scholarships that are available, both for international students and just in general. ASDA does have a website, or has a listing of scholarships that dental students are eligible to apply for on the website that I encourage you to check out for, other than the National Health Service Corps and the military scholarships.
Okay, so there was a question about, can anyone check the job postings of the NHSC just to get an idea of the job listings? Yeah, anyone can do that. And if you go to the National Health Service Corps scholarship page, or actually any of the loan repayment, student to service, all of the programs that they have for there, on the right-hand side, towards the bottom of the page, there's going to be a little box that talks about going to the job site and looking for available positions, and you can just go there now or you can go there later. So
all right, let's see, I've got a question in regards to the HPSP. Oh, my bad, sorry. Next one, I'll write that off. Let's see, for the military scholarship, are there any requirements regarding parents' temporary rights release? So I assume that's either about parents getting a hold of information, medical history that you have given to the military, or any problems with getting information, I think, from your parents to the military. I'm going to say if you're over 18, your parents do not have a right to your medical history. You have to release it to them. I believe that's just the laws in the United States. I don't think that's, select just to the military. So if you have any further questions, I guess, about specific, like, medical information or something, you can let me know. I mean, there's a few exceptions as to what flies and what doesn't that I could, let you know about, but I think I answered that question right, but I'm not sure. Feel free to ask it again in a different way. I'm scrolling through the questions, so. I can do another. So let's see, what would the payback timeline for a health professional scholarship program applicant who later becomes an oral maxillofacial surgeon resident through the military? So how that works is you've got 4 years of dental school, that equals 4 years of commitment. And then when you're serving your 4 years in oral surgery school, that's if it's through the military, because there are some situations where you could take it through a civilian schooling. That's different. I'm not sure about that. I think that's case-by-case basis. However, if you're taking it through the military dental corps, through their oral surgeon program, that's 4 years that you are in school there, but those are just null. They kind of wash out. That's not 4 extra years. It's just you're serving those 4 years in, oral surgeon school, and you're also, you're treating patients and stuff in clinic and whatnot. So that's kind of just a wash. So 4 years in dental school, and you get out, say you go straight into oral surgery school, that's another 4 years. Then after that, you just have the original 4 years to serve that you got from dental school, from the HPSP scholarship. So that's all it is. It's just 4 years after that.
Looks like we have time for only 2 more questions. And I think the rest of the questions are about the military scholarship. Andrew, if you want to.
Okay. Yeah, I can do that.
Take a quick minute.
All right, so other than having a letter of recommendation from a high-ranking officer, are there any other ways HPSP applicants could stand out as a selection committee? So that leadership, for sure. The most you can do in undergrad, clubs, organizations, however high up you can get, but also, dedicated involvement, service initiatives and stuff like that. Anything, helping out in your community, doing, free dental clinics, free medical clinics and stuff like that. Any service you can have there. It kind of just shows, you're showing the initiative, you're showing you understand the call of duty, you understand, what it means to serve in more ways than just the military, but using all that to kind of tie back in to apply to the military. Certainly people have gotten in without, a letter from an officer or without, connections and stuff like that. If you've got good grades, you're committed to it, and a lot of your activities have sincere and, service, leadership-oriented implications, you'll be fine for sure. For citizenship in the military, so you get commissioned as an officer the day that dental school starts, you're eligible for commission, and you want to essentially commission as soon as you can. So if you've got to have U.S. citizenship by that, again, if you need to be a U.S. citizen to join the military, which I believe you do have to be. You are not considered a reserve officer. So you have to go for a monthly drill. There's no monthly drill. You do not have to do that. You're not. I believe you are considered as reserved. And again, there's like one. I said there's some times when like you might hear like call to active duty or something like that. And again, you have your school orders to go to school because that's what they want you to do. So they might say, hey, you need to go on active duty for 6 weeks or something. You're like, well, I've got school during that time. So they just put you on active duty on a piece of paper, except they're saying, oh, you're being stationed at the school you're going to school at. There's no monthly drill or anything like that.
Okay, I think that wraps up the Q&A portion. I'd like to thank the panelists on an excellent webinar. Not surprised, you all served on our panel before, and you guys always do a great job. I'd like to remind the attendees that this webinar was recorded, and a recording will be sent to everyone within 1 week. Pre-dental month continues throughout October. Join us next week for webinars on interviewing and non-traditional paths to dental school. All of the URLs on these slides will be saved for the last slide, so don't worry about writing them down right away. We encourage you to join the American Student Dental Association as a pre-dental member. Pre-dental membership offers a wealth of benefits geared to help you get into dental school. As a special incentive, join now and your membership will be extended through 2018. That's more than 2 additional months of membership for the cost of $68 a year. You can join online at the URL on the screen. We still have a few spaces left for ASDA's National Leadership Conference, November 17th to the 19th in Chicago. ASDA will have a 3-day track exclusively for pre-dentals with topics including admissions, DAT preparation, interviewing, personal statement, and hands-on workshops. New this year, we'll have 2 morning sessions where attendees can meet with students from every U.S. dental school. We hope you'll join us for this special event. Please like us on Facebook at Facebook.com/ASDA Predental. Here you'll find national and local event information, pre-dental tips, and resources. Lastly, please participate in NASDA's Pre-Dental Month Instagram contest. Tag @dentalstudents and use the hashtag ASDA Pre-Dental Month and the weekly theme to enter. Thank you all again for your participation. Thank you to the panelists, and everyone have a lovely evening.